Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to explain ocular ischemic syndrome. Because extensive microvasculature that's very fine feeds into the complex structures of the eyes, um, and any abnormalities in the heart or its vascular system can affect the eyes and present with a specific pathology. Such conditions include the increased permeability of the vessels, excess lipids or sugar levels, and increased blood pressure, and therefore they can have an adverse effect on our ability to see. Hypertension specifically also causes characteristic changes in the retina. Ocular ischemic syndrome is a widespread ischemia of the anterior and posterior segments of one of the eyes because of ipsilateral carotid occlusion. This will present itself with 90% or more of the occlusion of the cross-sectional area of the ipsilateral carotid artery. There is an ophthalmic artery occlusion. This is another possibility of the cause of ocular ischemic syndrome. And the blood supply to the eye would be unaffected overall until the carotid obstruction exceeds 70%. Let's look at the anatomy of the retina before we move on. When you view the retina through a fundus exam, you may find different parts of the retina. The fovea and the macula is located in the temporal side, and this has the highest concentration of cones that make up your central vision. Optic disc is located nasally, and this is a point of exit for all the ganglion cell axons. The light converging here will not be perceived, and thus this forms a blind spot. The vessels of the retina and both the veins and the arteries can be seen also with the fundoscopy exam. The cross-section of the retina will reveal that the retina itself has lots of different layers that include various different nerves for communicating, ganglion cells for receiving the eventual electrical signals that has been translated from the light signals, and photoreceptors for the translation of the signals themselves are present. The Bruch's membrane is the deepest layer, the outermost layer of the cornea, I should say, and it borders the choroid, which is a supply layer of the posterior uvea that feeds the retina. Here is a lateral view of the vasculature feeding the eye. These vessels arise from the ophthalmic artery, which in turn is from the internal carotid artery. Risk factor of an individual developing ocular ischemic syndrome includes being 50 to 70 years old. Males have an unproportional predilection of having ocular ischemic syndrome. Atherosclerosis, ischemic heart disease, hypertension, and diabetes, as well as stroke history and peripheral artery disease, can also give rise to ocular ischemic syndrome later on. Some symptoms of ocular ischemic syndrome include loss of vision over weeks, and there may be associated with dull eye pain or headaches, amaurosis fugax, which is a temporary loss of vision similar to a black curtain coming over your eye. This can be experienced due to severely diminished blood flow. Delayed recovery after bright light exposure is also signaling the diminished blood supply to the retina. Some signs you may notice with observing a patient with ocular ischemic syndrome may include decreased visual acuity all the way from 20/20 to non-light perception, a retinal arterial narrowing and venous dilatation without tortuosity. Retinal hemorrhages are also possible, as well as macular edema, neovascularization, and arterial pulsation upon putting a light pressure on the globe with your fingers through the eyelid, of course. So a fundus exam would be very important in suspected ocular ischemic syndrome. Differential diagnosis for this disease includes the following list. Most of them includes the vasculature and problems with the retina. And Takayasu's disease is vasculitis that can cause amaurosis fugax, decreased pulse in one of the arms, and asymmetric features such as history and physical exams. For this, take a thorough ophthalmic history from the patient, do a comprehensive slit lamp exam, paying attention to the pupils, and in a slit lamp exam, look at the anterior chamber for any signs of inflammation. Try putting digital pressure on the eye with the eyes closed to see if you can incite an arterial pulsation. Most important of all would be the fundus exam. When you do a fluorescein angiogram, delayed blood transit time may be noticed. So AV, arterial venous transit time, lasting greater than 11 seconds, or a delayed or patchy choroidal filling that lasts greater than 5 seconds, and arterial vascular staining may be noticed. For electrophysiological testing, electroretinogram may present with reduced or absent A or B wave amplitudes in the case of ocular ischemic syndrome. The treatment of ocular ischemic syndrome includes the pan-retinal photocoagulation, which involves shooting lasers, leaving behind the 500 micrometer diameter burn spots on the retina. This is to prevent the progression of neovascularization. Carotid endarterectomy is done to relieve carotid obstruction, and these procedures are best done before development of rubeosis, which is vascularization, neovascularization of the iris. New blood vessel growth on the iris is dangerous because it could occlude the outflow tract or the trabecular meshwork. This can result in a highly increased intraocular pressure, which can damage other fine structures, including the retina. You should treat any increased intraocular pressure, which can occur from what I've just discussed. Glaucoma surgery is done if the anterior chamber angle is closed to secure the outflow tract of the fluids within the eye that's constantly being produced. The prognosis of ocular ischemic syndrome is poor. There's a 40% chance of a 5-year mortality rate since diagnosis, and 60% that at 1-year follow-up, the patient would have vision that's worse than counting fingers level. 25% will have greater than 20/50 vision, however. And when rubeosis is present, 90% of the patients will have a vision less than counting fingers within a year. And you can see the picture of the rubeosis on the bottom there. 1/3 of the patients have increased vision after carotid endarterectomy, and 1/3 remains unchanged, and the last 1/3 may worsen despite the surgery. So here is the link slide again. Hopefully we were able to show you that ocular ischemic syndrome links the ophthalmology and cardiology quite significantly. Here is a summary chart of everything we have talked about. And here is the reference from which we pulled the information. Thank you for watching this video.